Hi, good morning. It is a true pleasure and honor to welcome Dr. Viviana Martinez Bianchi to the stage. Dr. Martinez is a family physician, educator, and global health leader originally from Argentina and now based in the United States. She currently serves as the president-elect of Wonca, the World Organization of Family Doctors, and will take up the role of president in 2025 September in Lisbon conference. At Duke University, she is Associate Professor and Director for Health Equity in the Department of Family Medicine and Community Health, where she has been driving force for inclusive care and medical education. A fierce advocate for health equity, Dr. Martinez Bianchi co-founded the Latin 19 Coalition to support Hispanic communities during the COVID-19 pandemic and has advised both state and national health bodies on equitable access to care. Her leadership extends across continents and communities, from mentoring to the next generation of family doctors to shaping global strategies in collaboration with the World Health Organization. She has been recognized with numerous awards for her work in humanism, health equity, and community impact. Please join me in welcoming a visionary voice in family medicine and a tireless advocate for justice in health, Dr. Viviana Martinez Bianchi. Stage is yours. You're welcome.
Hello, dear colleagues at the 24th International Eastern Mediterranean Family Medicine Congress. It is my pleasure to speak to you today. I'm very thankful to Professor Mehmet Ungan for hosting this presentation. I will be talking as your Wonca president-elect about primary care at the crossroads, advancing health for all through equity, excellence, and innovation in family medicine. So before we move forward, I want to engage all of you in the spirit of this moment. If you believe you're an innovator in family medicine, please stand up. And I hope Dr. Ungan can help me with this. I want everyone who's an innovator to stand up. Look around you. These are the pioneers, those who will change, are making changes in our field. If you believe in advancing health for all, stand up and join them. So those who are standing, the innovators, stay standing, and those who want to advance health for all, please stand up. If you haven't stood up, I want you to look at those who are standing and think about the importance of following in their steps. If you are a young doctor or a medical student and you didn't stand up earlier, please stand up also. And I want to thank you all, those who are new and just starting, and those who have the wisdom of years of practice in family medicine. And I want all of us standing here in this moment, or sitting and perhaps wondering whether to stand or not, to work together, because together we are the movement that will transform healthcare. Together we will transform healthcare. Together we're taking care of families, individuals, and communities. We are taking care of millions of people around the world. We're doing it together. Yet, despite extraordinary advances in science and technology, our world remains deeply unequal. Millions still lack access to basic health care. Life expectancy varies drastically by zip code, by income, by ethnicity. And for far too many people, healthcare is a burden, not a right. In 2021, access to basic healthcare caused financial hardship for nearly 2 billion people, while over 1.3 billion were pushed back or pushed deeper into poverty just trying to access basic services and medicines. At least 4.5 billion people, more than half the world's population, are not fully covered by essential health services. That dream of universal health coverage is far from being reached. The movement for UHC 2030 is far from being reached. Political decisions determine if your patient can afford medications, if they have access to health care or not. Every decision at policy level affects what happens in our lives. Health is a political choice, said the WHO Director General back in Adana in 2018. And we know that every political decision will impact health. Health is a political choice. So within this concept, how do we reimagine health systems that are just, inclusive, and resilient? In this world, how do we reimagine health systems that are just, inclusive, and resilient? The answer lies in the power of primary care and in the leadership of family doctors, in your leadership, in your participation, and in the participation of your teams. How, in this present world, how do we develop health systems that respect and support the core values of family medicine and family doctors? We're often part of the interstitium of our society. Remember when we were learning medicine and we were talking about the interstitium, that vital space where everything happens? Well, that interstitium is invisible to the eyes and ears of those who don't know about the body. We, family doctors, are often part of the interstitium of our society, invisible to the eyes and heard by the ears of those who don't understand family medicine or cannot understand our value. Yet, just like the interstitium is to our bodies and our lives, vital to our patients' health, vital to health systems. And now back to the title of my talk. Let's start with equity, the foundation of our commitment to health for all. Health equity means that every person has the opportunity to achieve their full health potential, regardless of who they are, where they live, or what resources they have. Yet, I like Dr. Kamara Phyllis Jones' definition. Dr. Jones is a family doctor in the United States, an amazing mentor and past president of the American Public Health Association, who's invited us to think about health equity in a different way. She said, health equity is a process of assurance of the conditions for optimal health for all people. And it requires at least three things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. As advocates for health equity, we want to leverage our privilege and platform as health professionals to amplify the voices of those who have been silenced, to advocate for those who have been overlooked, and to fight for a future where every individual has the opportunity to thrive. And why do that? I talk about amplification of voices. Because research shows us, and this is research that my colleagues and I had done at Duke University in the United States, where I practice family medicine and I'm director for health equity. We saw that systemic exclusion occurs when communities experience continuous and compounded legal, regulatory, and political injustices that hinder a population's ability to achieve health and well-being. And for that reason, we need to really work on improving access, on improving equity, on improving understanding. What are those issues? What are the factors? Because achieving health equity is not just a moral issue, it's a strategic issue. Health equity is created through courageous leadership, community partnerships, and policies that center the needs of those most often left behind. Family doctors play a central role here. We are often the first and sometimes the only point of care for entire communities. We see patients not just as cases, but as people. We understand the social determinants, what brings them to poor health or to good health. We are embedded in the very fabric of the community, which gives us both insight, knowledge, and influence. If we want to advance health equity, we must invest in family medicine. We must ensure that every community, rural or urban, rich or poor, has access to comprehensive, continuous, person-centered care. And now I want to talk about excellence. And excellence is a concept not as perfection, but as persistence. Excellence as the daily commitment to show up, to serve with compassion, and to improve with every patient we see. Excellence in family medicine doesn't always make the headlines. It happens quietly in the long conversations, the home visits, the prevention and early detection work that never makes the news. The work that family doctors do that often doesn't make the news. It's a quiet work. It is excellence that sustains health systems. Family doctors are often undervalued and overstretched, but we are also incredibly innovative and resilient. We build trust, we span generations, and we bring clinical skills to contexts that others might find impossible. That, to me, is a definition of excellence that no technology can replace. And let's talk about innovation. Yes, digital health is the future of healthcare, but the future of healthcare has to be inclusive, look at both individuals and communities, be digital, and be embedded in the global arena. Yes, digital health, AI, and telemedicine are transforming how we deliver care. Those tools are powerful, and family medicine must embrace those tools and train AI to understand family medicine thinking. If we don't use it, AI doesn't understand our thinking. We want to feed the artificial intelligence machine with the way we family doctors think. And we also must broaden our definition of innovation. Innovation is not just about apps and algorithms. It's about redesigning care to be more inclusive, more team-based, and more community-driven. It's about training the next generation of doctors in equity, empathy, and systems thinking. It is about integrating mental health into primary care. It is about partnering with community health workers and traditional healers. It is about listening deeply to our communities to see what is it that they actually need. In that sense, innovation begins with relationships. and family medicine has always led with relationships. The relationships is what makes family medicine relevant. Relationships are what matters. So where do we go from here? We need to invest in family doctors, not just as clinicians, but as leaders and change makers. We need to invest in family medicine in the community and in the academic medical centers. We need to make sure that every university has a department of family medicine so that we attract more people into family medicine and primary care to understand the importance of our specialty. Yes, we are at the crossroads. Being at the crossroads means we are at a critical point where you have to make an important decision. And the decision may be hospital-based care or community care that makes the biggest difference across multiple communities. The crossroads is a side where health systems are undergoing major shifts, technological, financial, and political. One that could either strengthen or weaken primary care. On the other, persistent disparities in access, quality, and outcomes remain, especially for marginalized communities. And in that crossroad, for those who are young, the crossroad may be making a decision, family medicine or not. For me, that decision was the best decision I made in my life, to go into family medicine, to be able to make changes in one individual at a time, one community at a time, and now globally. In this work that we're doing, we need to strengthen primary care systems so that they are equitable, accessible, and accountable. We need to generate research and evidence, engage with community, conduct and disseminate research that highlights health disparities and proposes evidence-based solutions. We need each one of you to invite research into your clinical practices. If you don't have experience in research, please get together with a researcher that can help you generate studies out of the questions you may have. Data and evidence are critical for informing policy decisions and advocating for change. We need the data supporting our claims. We know it because we see it every day. We know that our patients' health gets better through access to our primary care services. Our patients' health gets better through the care we provide to them. We need to help turn what we know intuitively, and we know it by our own experience, into data to support the claims as the value of family medicine for countries and health systems. We must amplify the voices of community, particularly those who have been historically marginalized. We must amplify the voices of family doctors and general practitioners. If you're attending this meeting, I want to know, and Dr. Ungan is going to help me with this because I'm not there to see your responses. I want to know whether you are a member of your association of family doctors. And if not, I invite you today to become a member, because numbers imply a higher, wider voice. We need to amplify our voice. We want to join forces with others in your regions and the world. Collaboration amplifies your impact and brings diverse perspectives and resources to the table. If you haven't, join Wonca's working parties and SIGs. Join your country family medicine association or academy. Join the movement. Mentor and support the next generation of healthcare professionals who are committed to health equity. Provide guidance, share your experiences, and inspire them to continue the fight for a more just healthcare system. Engage policymakers, share the importance of family medicine, become their doctors. This is a picture of the meeting where I just came back from. I was presenting this in Korea at the Asia Pacific Regional Meeting, and I am now presenting to you. Become a fighter for universal health coverage. We must ensure universal health coverage is not just a policy goal, but a lived reality. And that every person everywhere can say, yes, I have a family doctor. Yes, I feel seen. Yes, I feel cared for. Yes, I have hope. Let us innovate boldly and advocate relentlessly. And let's do it together. Relentless like tábanos. Tábanos, if you don't know, is the Spanish name for horseflies. Relentless in the pursuit of health equity, just like horseflies. You know how they come after horses, they come after people, they're there. Relentless in the pursuit, in our case, of health equity. Holding ourselves and leaders accountable, the data supporting our claims. To all of you here today, thank you for the work you do. Thank you, thank you, thank you. You are the heartbeat of your health systems. You are advocates for health justice. You are scientists and storytellers. You are healers. And as we look to the future, know this. Family medicine is not only relevant, it is essential. It is essential for people, it is essential for health systems, it is essential for the world. There are millions of daily stories of people around the world advancing health for all, and another equal number creating policies that worsen health disparities. The world needs your work. Our planet needs our advocacy. Our planet needs our work. Advancing health for all through equity, excellence, and innovation in family medicine is a lifelong journey. It requires dedication, perseverance, and a deep sense of justice. We have the power to make a profound impact on the lives of countless individuals and communities. Embrace this responsibility with passion and determination. Let us lead with equity, strive for excellence, and embrace innovation, not for its own sake, but for the sake of humanity. Health for all is not just a dream, it is a shared promise, and family doctors and our teams are essential in making it a reality. Thank you very much. Thank you. I am really sorry not to be there in person, but thankful for the invitation and for you for paying attention. Thank you.